Your healthcare provider has recommended that you take progesterone and oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone and oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol. But with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to 1 line or 2 to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just 1 time. We know you're already clean. Just wipe it 1 time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a Sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil.